Causes and indications of nail biting in psychology. Many people resort to following many involuntary behaviors to get rid of stress and anxiety, such as tampering with locks of hair, taking off and wearing rings frequently, or nail biting, and nail biting is considered an unhealthy habit. Causes and indications of nail biting. The habit of biting nails may be an occasional condition where a person can get rid of it on his own, but it may turn into a repetitive behavior that cannot be eliminated, and this condition and similar habits are known as body-focused repetitive behavior, BFRB. Although there are no clear reasons for this behavior, there are some factors that may lead to nail biting, and we mention the following. Genetic factors. Some studies have shown that children whose parents used to practice nail biting are more likely to follow this behavior, even if the parents stopped biting nails before the child was born, but it has not been scientifically proven that nail biting is a hereditary condition. Psychological stress. Nail biting is a habit that may reduce stress, anxiety, or even relieve boredom, so some people do it to relieve stress. Extreme focus. Sometimes some people practice nail biting without awareness, so they are in a state of intense focus on something, or when they are facing a specific problem. Feeling bored. Some people bite their nails involuntarily when they feel bored, hungry, or lonely. It must be noted that people who have the habit of sucking fingers or thumb sucking may suffer from the problem of nail biting in the future. In addition to the above, nail biting can be associated with mental health problems, including the following. Attention deficit hyperactivity disorder. This is a chronic condition that includes difficulty paying attention, hyperactivity, and impulsive behavior. Oppositional defiant disorder. A disorder that includes stubbornness, defiance, vindictiveness, and frequent and persistent anger. Separation anxiety disorder. This is a psychological condition that involves anxiety about being separated from certain people or pets. Tourette's syndrome. A disorder that involves making involuntary movements or sounds. Other behaviors and habits, such as persistent scraping, scratching, or pinching of the skin, hair pulling, cheek biting, and teeth grinding. The habit of biting nails. The habit of nail biting causes many damages, including the following. Damage to the skin around the nail, and this may lead to an increased risk of infection due to the transfer of bacteria around the nail to the mouth. The transmission of germs from the finger to the mouth, which causes stomach diseases and various infections. Damage to the teeth, which leads to their destruction. Redness of the tips of the fingers and pus coming out of them, and it may cause blood to come out of them as well. The occurrence of imbalances and distortions in the shape of the nails when they grow, if the habit of nail biting persists for long periods. How can get rid of the habit of nail biting? Doctors recommend some tips to help get rid of the nail biting habit, including: trim your nails frequently in order to reduce dirt and germs that can enter the mouth. Use a bitter-tasting nail polish. This type of polish is safe, but its bitter taste prevents you from biting your nails. Wear gloves or cover your fingers with tape. Focus on something else when you feel the urge to bite your nails, such as playing with a stress ball or putty in order to keep your hand as busy as possible. Find out what is causing you to bite your nails, such as stress or anxiety about something, and then try to get rid of it. Follow the step-by-step approach recommended by doctors to kick the habit by stopping biting the nails of each finger separately, like starting with the thumb first, then the pinky, and so on until you get rid of this habit completely.